Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. I want to welcome you back to Aging in Place Strategies and Answers. And today we have another great topic for you. And I want to encourage you to hang in there with us because we're going to be talking about healthcare. But the reality is healthcare does not need to be scary when you have tips and tools that can help you through the process. Here's a statistic I want to throw out first to get us started, and so that you understand where we are in healthcare and especially senior healthcare. But in the next 30 years, the number of folks age 65 is going to double. And so, of course, seniors use the healthcare system, and we find that the healthcare system is already struggling to provide evidence-based care to older adults at every interaction. So to be totally honest, there are frustrations on the patient side, and I hear those frustrations daily from seniors, from their family members, from health professionals that are working with them. But on the other side of the picture is the physician. And there are just as many struggles there and frustrations for the physician. So did you know that 40% of physicians are retiring early or they're leaving their clinical practice? They cite burnout, the workload, and the frustration they feel when they have to convince insurance companies to pay for their clients' treatment. They're concerned about moral injury, which describes this knowing what care the patient needs, but being unable to provide it due to constraints outside the doctor's control, whether that be insurance or whether that be systemic issues. So let's acknowledge that there does need to be a change. And today I have invited Hedva Barinholtz-Levy to be with me today, and she's been a guest on our show before. But Hedva is a geriatric pharmacist, which is a specialty, and she also has a well-established community-based senior practice. But I think it's been, what'd you say, 2 years ago already that your book came out, Hedva?
1.5, almost 2. Yeah.
1.5, almost 2. And this is a book that you can get at the library, or you can purchase it and put it in your library. And so it doesn't matter who you're talking to. This book is going to have an impact on you if you take any medications, because the name of the book is Maybe It Is Your Medications. Maybe it's your medications. And then how to avoid unnecessary drug therapy and adverse drug reactions. So welcome back, Hedva. Thanks for being with us today.
My pleasure, Linda. Thanks for having me back. I
Uh,
appreciate that.
Oh, yes, it's always a pleasure. So, a month ago, Hedva and I were talking. And so, I know that you know this about me is that I have a passion for what I do. But if and anybody who heard Hedva in season one, when she was talking about her book and what she was trying to accomplish in that uh, work, is that we are both passionate about what we do, the information that we've learned in our careers, and how important it is for you to have this information. So I'm pretty much going to let her take this over, but just to give you hope and to let you know that we are not the only ones seeing the problems. This new age friendly health systems initiative. So, Hedva, go ahead and tell us about it and what's included in this. And then hopefully you'll help us figure out how we can have a better interaction in our, meetings with our healthcare professionals.
I'd be happy to. Thank you so much for and this is a great chance to talk about this age-friendly healthcare system initiative, as you mentioned, because the more people who know about it, the more empowered we all can be to age in a more healthy manner, independently, where we want to, how we want to age, and really help drive our care. So, we'll talk about that for a bit. So, I'm a pharmacist, and this is a health system initiative, if you will, but it partners very carefully, closely with the medications. And one of my pharmacy colleagues has been very involved in getting this age-friendly health movement off the ground, if you will. So I'm happy to be talking about it as well, because medications is such a part of our healthy aging. So the age-friendly health system movement was started back in 2017, so not that long ago,
Okay.
but a few years ago. It was created by the Institute for Healthcare Improvement, IHI, and the John A. Hartford Foundation. So it was a joint effort. And these agencies are all about improving healthcare and reducing medical errors and improving our processes and really trying to make the system, our healthcare, better. So this initiative came out of a need, the awareness that we have a gap in our healthcare provision. As we get older, there are gaps in the system. If you think about, it's not unfamiliar to the listeners, and I'm sure you've had so many, well, you have so many, had so many topics that talk about the complexities as we get older.
Yes,
So
ma'am.
healthcare becomes more fragmented. We have specialists involved. We have very few healthcare professionals who have that geriatric expertise. And as you mentioned, the physicians are leaving, they're retiring, there's burnout, there's overwhelm with these 7-minute visits and a lot of pressures on the doctors. So there's gaps in our healthcare system. And the Institute for Healthcare Improvement and John A. Hartford Foundation really did some research looking for evidence-based practices. How do we provide care to older adults that really show quality outcomes and improved healthcare outcomes? And they developed this age-friendly health systems movement, which is centered around the 4Ms framework. So we're going to talk about each of these 4Ms and what they mean. But the goal of this program, this movement, if you will, is to improve quality of care provided to older adults, to improve the patient satisfaction with the care they receive, to perhaps provide more consistent care, setting to setting. Every older adult deserves the same focus on the same key elements that evidence has shown really make a difference in improving health outcomes. So this whole age-friendly health systems movement is about improving the quality of care we provide as older adults from the healthcare professional, but the importance of talking about it to consumers, to the older adults and their caregivers, family caregivers and family members, is because their awareness helps them participate in a different way, more actively in their healthcare.
And that's something that I advocate for all the time. So this is just very appropriate. And this is for you. It's for you so that you can achieve your objectives and not just what is being told to you. So
right, it's a tool in your toolbox, right, that you can pull out and help drive your care and your involvement. And as you know, as we've talked with my focus as a pharmacist, and with my book, it's all about being more involved in your care. So this dovetails really nicely with my passion as a geriatric pharmacist.
Now, a quick word from our sponsor.
Do you want assisted living services but don't want to leave your home? Call Continuum at 314-863-9912. Our professional team has 20 plus years of experience and will help you create the perfect care solution that meets your current and future needs. Continuum supports independence at every stage of life. Call 314-863-9912 for a free consultation or visit us at continuumcare.com.
So, great to be able to talk about it. So, and you mentioned the growth of our aging population. So for all these reasons, we have a healthcare system that is just not really prepared for an aging population, this age wave that's upon us. So the 4Ms framework, as I mentioned, it's evidence-based. The M's, each of the M's stand for, if you're ready, the first is matters most. So that person-centered care is what matters most.
Yes.
Medications, mobility, so the ability to move around, and mentation. So that involves cognitive function, but we can also think about it as mood a little bit,
Okay.
and that mental ability. So those 4Ms make up this framework. And the framework provides a structure, if you will, a common language for every healthcare encounter. What's really interesting, so let me slow down. I want to cover all these different aspects. It was developed for the healthcare systems. So to apply this age-friendly health system initiative with the 4Ms, focusing on those 4 components, in a hospital setting, in a clinic, in a long-term care facility or rehabilitation facility, for
Okay.
example. So those healthcare settings. But when you think about these principles, in many ways, I feel I've been doing this, incorporating it in my pharmacy practice all these years. Think about any place where care is provided. So certainly in the pharmacy, and we do have an initiative where pharmacies can become age-friendly health systems, if you will. But even in when you're working with a social worker or physical therapy or occupational therapy, working with a care manager, we all should be thinking about the well-being of the consumer, the patient, you who
Yes.
are listening, from these perspectives. What matters most to you? And then how is the cognitive function, the physical function, that mobility
Yes.
piece, and then of course the medications. And if you think about these 4Ms, they're very interconnected. And as we talk about each one, I'll kind of move through each one a little bit separately. One affects the other. And so we need to think about them as a framework. So it gives us a language, if you will, wherever care is provided. I think even if the listener thinks about this tool, the 4M framework, even when they're speaking with their financial person or legal, housing, just all the different people that help us age together, age healthy, thinking about the different components might help identify a need or way to improve the quality of life, something that needs to be talked about. Does that make sense?
It does make sense to me because that's the way the company that I've worked for years approaches care, is that we're looking at those 4 things to see what can we accomplish in this picture, but what are your expectations? And then what are the factors that might prohibit you from meeting that expectation, but at least keeping what the patient wants at the center, and then trying to provide that as best we can, right? So
exactly.
I'm all about this. This sounds phenomenal. And I agree with you that if you just learn those 4 words, that you can take this into any application of how you want to age. All right. So good. Let's learn those words.
And like I said, it's a tool to say, hey, I want to talk about this. It's important to me. So yeah. So, and I'm going to refer a little bit to notes, but so the first M is the what matters most. Or so what matters or what matters most, is that how that M is used of sorts. So really it has to do with having a person think about what their priorities are, what their preferences are, in thinking about what care they don't want is an important thing to think about, right? So it's a way to help avoid unwanted care.
Yes.
So how do we get to that? It takes a lot of some introspection, and there's a little workbook that is available through the IHI.
That's good to know.
The Institute for Healthcare Improvement. So they can download a caregiver, I'm sorry, and I will be referring to it, My Health Checklist it's called. But it's a way to help individuals prepare for their healthcare appointment, if you will, a doctor appointment, or anytime you're meeting with someone regarding your health care. It's a really good way to kind of organize your thoughts and get them out of your mind and onto paper and help prioritize what you want to talk about. So when we think about what matters most, again, I'll come at it from the healthcare perspective, and as a pharmacist, patients have to understand the risks and benefits of any treatment option.
Yes.
Certainly, when you think about a medication or not a medication, or which of the two medications, or even with a healthcare procedure, surgery or non-surgery, what are the different ways we can manage the condition? So understanding the risks and benefits, balancing. We want to avoid overtreatment. So it all depends on what the person's personal situation is, how many healthcare conditions they're managing, how if they have frailty where there's more, more health problems going on, they need more assistance with daily activities versus they're more independent. So all of this really has to look at the person, and they have to be able to express and talk about what matters to them, what they feel is a priority for them at that point in life. And come to an agreement, if you will, with the healthcare professional who has all the knowledge of, we know what's KNOW, we know what's the treatments or the recommendations of the guidelines, but we don't know you, the person, the patient who's involved. So those conversations have to happen.
And I like to say that physicians, healthcare professionals are not detectives. Okay. So this brings the onus onto you now. Now you're going to start at the beginning and say, I'm going to do my homework. So if you have not drawn up a healthcare directive or seen, how to have these conversations, let's start a conversation, which you can go back through some of my episodes, which we've talked about these things. This is where you decide. This is what I want. But if we don't communicate that to the physician, then how are they going to know what we want? Now, of course, I could say, how are we going to do that in 10 minutes, right? Because a lot of visits are 10 to 15 minutes. So we have to be forward thinking in this. But this is the first step, people.
And that's where there's a preparation guide, again, kind of thinking in advance. And that's why I love how when you talk, you explain things in such a practical manner. So I love the information you provide to all of us, Linda. How do you start those conversations, right? So, and maybe it's the patient who has to initiate the conversation, but from a healthcare perspective, again, the more we're teaching healthcare professionals about the 4 M's, they will know to initiate the conversations, but yes, you feel comfortable speaking up and know that you need to speak up. So that what matters most really is the center, the crux of the other 3 pieces, the other 3 M's we'll be talking about, of course. I'm going to go to the medications M next, right?
Okay.
I feel more comfortable there.
That's
but
fine.
A lot of information for the healthcare people about the medications component. We know that there are high-risk medications in older adults. So there's better choices and less better choices, if you will, for the older patient. So safety issues, risk and benefit really has to be considered for different medications. So healthcare professionals need to be educated on what those higher risk medications are. Patients need to be educated to know that there are such things as higher risk medicines and to ask about them. Again, that's a lot of where my book goes and why I really wanted to put that good information out for people to understand that they've got to talk about risk and benefit. And when we think about medications, we want to make it easiest on the patient. So how do we simplify medication regimens to help you, the listener, the patient, the consumer, take their medications as easily as possible so it's not interrupting their day? So to come up with a very simple regimen, maybe once a day, twice a day, make it with meals or things that naturally fit in the flow of your day so you can take your medications more easily. The concept of getting rid of unnecessary medicines or lowering doses so we avoid problems. So those all have to do with the medication issues. A really important concept to just introduce is that we call them care transitions or transitions of care. So for consumers to know, anytime you're moving between a hospital to home or hospital to a rehabilitation place and then to home, or even I hate to say it, but in between doctor offices, right? Because each doctor office has their own medicine list of sorts. Yes, there's that electronic record where it should be consistent, but doctors' offices might have slightly different information. So it's important for the person to be their biggest spokesperson, advocate about their medications. This is my list. Have it with them. Make sure that everyone's looking at that same medication list. And also that you know how to use your medications at home. Say you're given a new medicine as you leave the hospital, or a new drug is prescribed at the ambulatory clinic at your doctor's office. You want to understand how to take that medicine and take it properly. So all these issues come up with the medications, and we can talk, of course, for an hour about that alone. But so the medication piece, and think about the medications affecting the other M's. Medications can affect cognitive function. Unfortunately, some medications can make you feel more drowsy, more groggy, forgetful. There's some direct memory issues with some of the medications. So there's that mentation piece can affect the medications, and medications can also affect the mobility when you think about fall risk, right?
Yeah, I wanted to just highlight two words that Hedva used when she was talking about medications, and that is risk and benefit. So if you're thinking about your medications, the questions you need to ask are, what's the risk? What's the benefit? And I've noticed that sometimes it is not the doctor that's reviewing that with somebody. It is actually maybe somebody in the office that says this is what's been prescribed. So if you don't know your risks and benefits and how long you're going to take that medication, and what if there's a cost factor to this, these are all reportable things. I know that pharmacy representatives come to the doctor's office with their products, but it's also good to review the risk and benefit with your physician, because you're the one who is going to be affected by it. And so if that's important to you, which it's important to me, because Hedva's book talks about the adverse risk sometimes of too many medications. So you are your advocate. Risk. So we think of medications now, risk and benefit. Easy question, easy words to remember. Thank you. I'm so glad you told me about that medication. What's the risk and what's the benefit? How long do you think I'm going to be taking this medication? And do you want me to report back if I have an adverse reaction in how many days? How long? They should know that information if they're prescribing the medication, right? And if they don't discuss that with you, could their local pharmacist help them with that?
Absolutely. And I always say the pharmacist is sometimes underutilized, but absolutely. Ask your pharmacist.
Okay. So if you forget to ask the doctor, because it will happen, then when you go to get your med.
Yeah. And I always say, check both ways. Get it from the doctor and still ask at the pharmacy, right? So one, you want to make sure that you're getting the same information, and it never hurts to hear something a second time.
Yes.
Just to drill it in. So
thank you.
Either way. Those are just key points at risk benefit, because that we don't always think about that. We assume medications are just fine, and they're not always. So, and I guess the one big thing I should say about medications is we want to choose age-friendly medications.
Yes.
And so those are the ones that are less risky. Though, as I mentioned, there's a group of medicines that tend to have more harm associated with them. As we get older, we're at higher risk or more susceptible to the side effects of certain medicines. We want to avoid those when possible, so we can use age-friendly. It's all about not taking away anything from our quality of life and our well-being.
Good. I like it.
All right. So then that was the matters most medications. The third M I'll talk about is mentation or mind. I mentioned mood, that kind of thing. And with this M, the framework talks about really focusing on dementia, depression, and delirium.
All right.
So it recommends that the healthcare team, the healthcare professionals, when working with older adults, focus on identifying screening for those three conditions and addressing them, treating them where possible. Delirium is a situation you want to prevent. It's about prevention mostly. We think of delirium happening in the hospital setting, unfortunately, most commonly, but focusing on ways to prevent delirium. So that's for our health system colleagues and practitioners really should be focusing on preventing delirium. The dementia and depression can happen anywhere, of course, but as we're caring for older adults, age-friendly care means that we're screening for and being aware of cognitive changes. So mild cognitive impairment, those early signs of what could be dementia, because sometimes it's reversible, again, coming back to the medications piece of it.
Yes.
But we'll talk about some other healthy lifestyle things that can help our mentation, our mind, and then depression as well. And as we get older, with loss, with isolation, that the risk of depression is a little bit higher, and we need to look for it because it's treatable, and we can, and not always necessarily with medication, but we can intervene to address those issues, which really can impact quality of life.
Of course they can.
Please continue listening for part 2 of the podcast with Hedva and Linda Prio, the host of Aging in Place Strategies and Answers, where we continue our discussion on age-friendly initiative and the 4 M's. And if you want to check out the initiative yourself and the workbook that's going to be mentioned in part 2, you can go to IHI.org, and you can download this workbook document in any language you want. And it starts off with My Health Checklist. And this guide is going to help you get ready for a medical appointment. And you might be wondering, well, why would I need to do that? But when healthcare gets complicated, that is when you want to have a process for communicating with your healthcare team professionals. So you can complete this guide in any order you like. You can take it in small pieces. You can talk about it with someone you trust, but these pages are for you. They are here to help you gather your thoughts. And if you're helping someone else complete this guide, then let them know why this can help. You might say something like, I want to make sure we talk about what's most important to you in your healthcare so that we can have a more useful and productive conversation with your healthcare providers. It will help us to really be focused on really what matters to you and how best to support you in this process. IHI.org, and please listen next week to part 2 of Age Friendly America Initiative. Thank you for joining me today. Please remember that this podcast is intended as education and not advice. Don't forget to share this podcast with family, friends, or colleagues who want to learn how to age in place, but also share this with those who find themselves in crisis mode. Please go to my website, seniorsupportstrategies.com, for more information. When you subscribe to Aging in Place Strategies and Answers, you gain access to premium content and professional tips on creating your own Aging in Place roadmap. As always, I value the time you spend with me.